In just 6 years' time, many blind patients will once again be able to see the faces of their loved ones, according to British researchers who pioneered a new stem cell treatment that can restore sight. The focus of the research to date has been with regard to macular degeneration, the world's most common cause of blindness, affecting 25 to 30 million people worldwide. Professor Pete Coffey is director of the London Project to Cure Blindness, Professor of Cellular Therapy and Visual Sciences at University College London, and is leading this groundbreaking research. Hello there, Professor Coffey.
Hello there.
Thanks for joining us. Busy times for you.
For sure, yes, very busy times. As with any announcement that seems to happen around this project, it's obviously one which produces a lot of interest.
Set the scene for us, if you would. Tell us about what actually happens to the eye when it comes to macular degeneration.
In macular degeneration, typically over the age of 65, the cells at the back of the eye, the cells which support the seeing part of the eye, what's called the neural retina, start to deteriorate and degenerate and eventually die. And as a consequence, the seeing part of the retina, that neural retina, no longer has its support available to it in terms of nutrients and getting rid of debris. So as a consequence of the death of those cells at the back of the eye, the neural retina, the light sensitive component of the eye, starts to die as well.
Now, for people who actually don't have the condition, they perhaps aren't aware of the impact that it has on everyday living. And I know that you've been working very closely with people with macular degeneration. Why is it that people have real problems actually distinguishing faces and recognizing people, even though they have reasonably good levels of sight left?
The problem is the disease itself tends to involve the central portion of the vision. So the vision which is involved in that high visual ability in terms of reading, writing, recognizing faces, the ability to drive, it's all within a very, very small area of the eye, which is a region known as the macula. And that central visual area goes, and it's devastating. People are unable to read, they're unable to navigate properly around the world, they can't see their loved ones, and they can't drive.
And yet, to people looking on, there's no visual display that there's a problem.
None whatsoever. There's no outward sign in that person which you would be able to tell that there is a problem.
Now, talk us through your exciting new research then.
What we've tried to introduce is, can we put cells back, replace those cells which have died, which support the seeing part of the eye. And what we've managed to do is turn stem cells into the eye cell we need to replace, which is that support cell at the back of the eye, which is called RPE. So we've managed to produce that. We can put it in a carpet, which it needs to be in, and we've transplanted those cells in animal models of age-related macular degeneration, and it stops those animals from going blind. But I think one thing to emphasize is this is a therapy where, as long as the neural retina is still intact, so as long as the seeing part of the eye is still intact, then we can use this therapy. If someone has had the disease for a number of years, and also they're no longer using their central vision, so if they're fixating peripherally away from that central visual area, this therapy may not help. This isn't going to regenerate a dead neural retina. That's not what this process is for. This is to put back the support cells.
So could this actually stop, in the cases of people who have had long-term damage, could it stop the disease actually progressing?
It could stop the disease from progressing, yes. So in those particular cases, if your central vision's gone, but you still have good peripheral vision, then it would potentially stop that from getting any worse.
Where do you harvest the stem cells from?
Stem cells come from human embryonic fertilized eggs taken from IVF clinics, donated in IVF clinics. And they're a component of that called the inner cell mass. So this is a 5-day fertilized egg, never implanted. And in fact, we never need to go back. We have one cell line, one human embryonic stem cell line, which has been developed, and that's enough. We do not need to keep going back to the source for more. So we've managed to scale up to clinical grade exactly what we would need for this therapeutic.
Is there a time, do you think, coming when you'll be able to harvest these cells from the patient themselves? Because there's quite a lot of controversy at times about using embryonic cells, isn't there?
There's ethical issues for some people as whether they would be prepared to go through such a therapeutic. In this case, a new technology is on the horizon where you can actually turn skin cells into human embryonic stem cells, and they're called inducible pluripotent stem cells. But that technology is very much in its infancy. We are working on that technology, and we've had some good results, but there's a significant lag behind that technology versus what we can already do with human ES cells.
So using embryonic stem cells, will there be an immunological response from the body? Will the body try to reject them?
The eye itself is what's called an immune privileged site, which means the immune system doesn't tend to go into the eye. So therefore, the place in which we're putting them in its own right is a good place to put some cells where you may think there would be an immunological response. Equally, we've also done a lot of preclinical work to look at whether these cells do induce immune responses, and at the moment we don't see that.
So how straightforward will the treatment be then?
The treatment itself is actually a surgical procedure. So a surgeon needs to place the cells into the back of the eye. That is invasive. We'll need a vitreoretinal surgeon to do that, but uses procedures which are already available and standard practice in the clinic. So we would hope that this whole procedure could be done in less than an hour.
As quick as that. When will human trials actually begin?
This whole area is new. No one's done this before. The regulations in terms of going into the clinic, no one's really done that. To have Pfizer on board to help me with this whole process, who have immense experience with medicines, is phenomenal. So we're actually developing the pathway as we go along. No one's done this before. It is a brand new technology. No one's done it. We're hoping in the next 2 years to be able to go into those initial trials. But again, it's dependent on this whole process in its own right, learning about this new technology.
As you mentioned Pfizer, they're the pharmaceutical company. How much of a difference does it make having a company like that backing the research?
It makes a huge difference. The ability, their expertise, it is truly a partnership. To have them on board in terms of ensuring that everything's safe, ensuring that the cells can be delivered to the clinics properly, in terms of the scale-up, because this is a huge clinical problem. To have the world's #1 pharmaceutical company backing this project is phenomenal.
Is there a risk for somebody having the treatment that it might not work and they actually end up with less sight than they had beforehand?
I'd say in that case, no. I mean, the patients who will go to those first clinical trials will be losing their sight. And again, we're not going to do anything unless we're sure of the safety. If there is an issue about that and a problem occurs, the person effectively isn't going to lose any more sight than they would have already from the progression of the disease.
When do you hope that this treatment will be available then?
We reckon probably following those initial trials, and you have to go through this phase trial, phase 1, phase 2, phase 3, phase 4. From those initial trials, we would imagine 5 to 6 years after that it would be scaled up as a therapeutic.
Because we often hear in research the figure of 5 and 6 years. Do you think this is a realisable goal?
I do think it's a realisable goal, and I think the reason why I am even more confident of that is the fact that we have someone like Pfizer there with us.
When you make an announcement like this, of a treatment like this, I think we tend to not realise the amount of work. How long have you actually been working on this therapy?
This whole concept and idea was, I'd say, born in Christmas 1998. I know the exact sort of month because there was a group of us got together and it was snowing. To put it into context, That the first human embryonic stem cell was only produced in 1998, and just 10, 11 years after that, here we are seriously considering putting this into a therapeutic. If you look at the introduction for drugs for cancer, for heart disease, it takes 20 years. So I think actually we are doing extremely well.
Well, I'm sure people listening with macular degeneration will be very encouraged by your words. But for the meantime, we wish you the best of luck with your work. Professor Pete Coffey, thank you very much for talking with us here on Insight Radio.
Pleasure. Thank you now.